Hello viewers, welcome to Hornbill TV. My name is Paulami. Today again we are at Swagat Hospital, Guwahati, Assam with the 4th health series of Department of ENT. So today at the onset, I would like to welcome to our show Dr. Swagata Khanna ma'am. She is the director and the chief consultant of Swagat Hospital, Guwahati, and Dr. Dipanabha and also Dr. Prisni ma'am with us today. Ma'am, thank you so much for being here with us. It is our immense pleasure to have you here. So our audience would like to know a few things about the Department of ENT. So shall we begin? Ma'am, we would like to know about the ENT department of Swagat Hospital. Also, we have been told that Swagat Hospital is very well equipped in this, department. So we would like to know about it. Can you please tell something about it?
Thank you very much for coming and taking our interviews. Hello viewers, greetings and Diwali wishes to all of you. I am Professor Swagata Khanna, former professor and head of the Department of Guwahati Medical College. Presently, I am the director and chief consultant of ENT and head and neck surgery at Swagat Hospital. With me, we have a very good, well-equipped department. We have 5 consultants. Today, 5, three here. Dr. Dipanabha Jyotidas, he is 10 years with us, and Dr. Prisni Devi Datta, she is also with us since last 6 years. So we are doing all together, all very good work we are doing. Along with us in our team, there is an oncosurgeon who basically look after the cancer patient, and Dr. Paramita Chakraborty, she is the head of the autoneurology department. She looks after patient with dizziness, then the tinnitus, that means a ringing in the ear, or migraine. It's a very common ENT disease. So she looks after this patient. So we have a very good department, and I think it is the oldest and well-equipped department in entire Northeast. We deal patient with various surgeries like tonsil surgery, adenoid surgery, then nasal surgery, ear surgery, thyroid surgery. These are the thyroid and the parathyroid. We started in the Northeast first endoscopically. So there is no scar. So all these things are possible because of we have necessary equipment and advanced technique also. So with the equipment that is called your coagulation technique, and also without cautery we can use that. And then one is a robotic surgery also. We have started the robotic surgery, which is very new, and it is only available only in our hospital in the entire Northeast. So that's why I feel that this department is very much well equipped, and we have a good number of surgeons and consultants, so that we can handle all types of ENT diseases.
Thank you so much, ma'am. Ma'am, also we would like to know the common ENT disease you have seen. And according to you, this child deafness is very common, or like what are the preventive measures which have been taken from your side?
That there are many ENT diseases actually we ignore. Many people ignore that simple headache or simple sneezing or simple common cold, throat pain, they do not used to come to an ENT doctor. So actually not. These are, if it is not treated properly during on time, it may sometimes lead to some serious complication. So we encounter patients in our daily OPD, in our outpatient department, with a patient with chronic tonsillitis, that means pain, throat pain, then with a child with a enlarged adenoid, which nasal obstruction, or sometimes they suddenly get up in during sleep. Then with a nasal obstruction because of some polyp presence in the nose, or maybe deviated nasal septum, sometimes with the discharge in the ear, and which lead to deafness ultimately. Then sometimes swelling, thyroid swelling, which is a very common disease in this part of country also, and sometimes the salivary gland tumors. And the Northeast is the hub of your cancer. the head and neck cancer is a very common in this part of the country. So we usually get these types of patient. So these are the common diseases we encounter in our daily OPD. And apart from it, that you have asked me about the child deafness. Yes, child deafness is common because the rural people, they are very ignore about taking care of mother. So mother, if a healthy mother, then a healthy baby. So if we do not take care of the mother, how can you expect a healthy baby? So it is very essential to take care of the mother, preferably during the antenatal time. That means during the pregnancy time, proper vaccination, proper food, proper exercise, and a good hygienic and healthy environment is very essential so that she can deliver a healthy baby. So mother's diseases like rubella infection or some measles infection, if the mother is a diabetic, if mother has some tuberculosis and she is on the drugs, so naturally the baby will go to all these complications and may deafness to be there. So this is another thing. And vaccination is very important during this newborn baby, and after that we have to give the vaccination in a divided doses. This is very important. The mother should be and the whole family should have a good knowledge about breastfeeding, because in the rural area, the mother doesn't know how to feed. So there are some technique so that there should not be any infection towards the ear. So sometimes this is also an essential part. And also sometimes you see, when there is some infection in the ear and the child or children go for that swimming, or there is entry of water and may lead to some serious complication, and finally there will be deafness. So these things can be prevented, So if the proper education to the mother or the rural people and the prevention of these things, that not to go to swim with a ear infection, so these things can help. And apart from this, one is very important. Nowadays we have seen the ear of headphone and that earphone constantly they are using, which also lead to deafness. So we should prevent it. So I think these are the some main important causes of deafness in children, and we can prevent this.
This was really important to know for all of us. Thank you so much again. Ma'am, also we would like to know the different procedures and the facilities available at your department, and for what all diseases.
I have already spoke to you that the various surgeries we are doing for example, the tonsillectomy and adenoidectomy, the ear surgery. So these things to be done by our some newly very important equipment we are using. So coblation technique. This is a very modern technique by which we can reduce bleeding, reduce pain and reduce hospital stay. So that's why most of our patient they like it. And also we are doing also microsurgery of the ear, for that if their eardrum is perforated or there is some long chronic otitis media for which the patient unable to hear. For this we go for micro ear surgery. If there is chronic sinusitis, we go for functional endoscopic sinus surgery. Like this. So these are the some important surgical procedure we are regularly done, and for this is possible only because we have the modern available equipments are with us. And one is your that harmonic scalpel, which is a very important for tonsillectomy or some thyroid surgery. With this equipment we can minimize the bleeding. Similarly, the coblation I have already told you about it. Micro ear surgery, for that we have a well-equipped microscope. Then for functional endoscopic surgery, we have good endoscope also. And recently we acquired, we have the robotic surgery. So I hope all this availability of equipment, we can able to do these modern techniques and these surgeries. Yeah.
Correct. Thank you so much, ma'am. So today our viewers would also like to know what are the emergency ENT cases which you have seen at the hospital, and how do you manage it?
Emergency ENT cases we see very regularly. The common ENT cases that we see are bleeding from the nose, also known as epistaxis. This is one of the most common things that we see. We also see injury to the facial area, head and neck area, maybe because of a road traffic accident, maybe because of assault. We also see foreign bodies in the nose, ear, and throat. We also see patient coming with respiratory obstruction or breathing difficulty, which may be because of a late stage cancer or a neglected cancer of the head and neck region. Regarding the management, speaking stepwise, if we talk about epistaxis, which is bleeding from nose, it depends on the age group, it depends on the cause, it depends on the pre-existing disease or any medication that the patient is using, and accordingly we have to tailor our treatment. Now regarding the foreign bodies of the ear, nose, throat, definitely we have to remove it as an emergency basis. Then regarding the injury cases, so most of the time injuries come with soft tissue injury, that means injury to the skin and tissue. Then bony injury, that means any break in the bones, like a maxillary bone or a mandibular bone. So in these cases, obviously we do the initial repair and later we proceed for definitive reconstructive surgeries of the or reduction surgeries of the fractures. And regarding the breathing difficulty cases, so mostly the cancer patient that come with obstruction, we emergency do airway procedure, we call it tracheostomy, and after that we evaluate, depending on the stage and extent of the disease, we have to proceed accordingly.
Thank you, sir. Sir, what a patient should do if he or she is bleeding from nose? Like, what are the preventive measures?
First of all, when you are having bleeding from the nose, the first thing is do not panic. Panic increases the heart rate and blood pressure, that further increases the bleeding. So first of all, do not panic. Do not lie down. One should sit upright and preferably lean little forward. So by this way, you are preventing the blood from going inside your body and rather you want it to get it out. Pinch the nose very tightly below the bony part in the soft part of the nose, in this part. We should pinch it very tight and we should breathe through our mouth gently. Preferably we should pinch for at least 5 minutes. In between, do not check whether the blood has stopped or not. The pinching should continue at least for 5 minutes, if possible even more. And sometime putting some ice in the forehead and where the nose is, the area where the nose and forehead meets. If possible, we can put some ice there. That leads to vasoconstriction or shrinking of the blood vessels. That can reduce the bleeding. If bleeding does not stop in 10 to 15 minutes, you should always visit a ENT doctor. Even if the bleeding stops, but if it comes back again after some time or the next day or even after a few days, then also you should always visit a ENT doctor and to find out what is the actual cause of the bleeding.
This was really helpful. We all should know because there's a common thing which happens in each and every. Ma'am, what is sleep apnea and what are the risk factors of sleep apnea?
Yes, very good question. Sleep apnea actually some disorder in the sleep while patients while going to sleep and suddenly patient got up because of some suffocation or some obstruction in respiration which is called sleep apnea. And this actually in our term we call it obstructive sleep apnea syndrome. That means obstructive means there is some obstruction in the respiration, so that's why patients had got up from the sleep. And it is seen in case of children because children have got the adenoid and that adenoid sometimes it gets analyzed and occupied the whole nasopharynx and there is very less space for respiration and there is sleep apnea, so sometimes get up and get difficulty in respiration. In case of some nasal, very gross deviation of nasal septum, presence of polyp in the nose, or there is some tumor in the tongue or in the upper part of the larynx, so that's because patient got disturbance in sleep and this resulting sleep apnea. And nowadays it also very common in some patient with a very obesity, and they create snoring while sleeping. Actually other people think that the patient is a very good sound sleep. Actually not, it is not correct. Patient is actually struggling for the good respiration, so he has not getting the good passage of air come out or taking, So there is a noise produced which is called snoring. So when this type of difficulty in respiration and got up from the sleep, so this is actually not healthy, and when this occurs, patients should not wait. They come to the doctor because later it will lead to some cardiac problems, respiratory problem. Patient has many problems. So that's why we have to correct it. There are many procedures we can correct it, and patient can have a healthy life.
Thank you so much again. Ma'am, I would like to know, why does people get repeated sneezing and they are allergic to cold and dust?
So generally speaking, mild exposure to dust or sudden exposure even to colder temperature can make anyone sneeze. But if a person finds himself or herself having multiple episodes of sneezing, suppose the person says that after getting up in the morning I sneeze 10 to 15 times, along with discharge, watery nasal discharge, and itching of nose and eyes, that means the person is allergic. And in ENT, this is called as allergic rhinitis. The disease is named as allergic rhinitis. So in simpler terms, I can say that there are certain category of people who have a sensitive nose. So upon exposure to these allergens, like it may be dust, which is found in the environment because of the pollution so much is there, or exposure to fungus, or even pollens, such are the trigger factors which causes these allergies.
So, how to manage those patients, and what are the newer treatment modalities for this allergy?
So for management purpose, as the symptoms which I have mentioned, once the patient comes to us with this history and the specific symptoms, we also do certain blood tests to know the level of allergy in the blood. And after that, we have the first line of treatment as tablets or oral medicines which are available. The commonly named as oral antihistaminics, as we commonly see in pharmacy, is a cetirizine, which is the most common name we hear. Along with that, we also have steroids, either as nasal sprays, and in severe cases of allergies, we also give oral medications of steroids. So in combination therapy of either one of them or both, we give to the patients who present to us. Then coming to our next question, which is the newer modality of treatment. Yes, we have immunotherapy as one of the modalities. I won't say it's quite new because it has been in the market for a few years, but quite newer to this Northeast region. Immunotherapy is one of a newer treatment which actually has a very promising result. We actually give to patients who don't respond to the oral tablets, and they say that after stopping these medicines we again get the symptoms. And also it can be given to those patients who suppose need a longer duration of steroid treatment, because steroid, especially the oral treatment, if we give for a longer time, they have some complications. Also in certain patients, if we have diabetes also, we can't give them more confidently. So immunotherapy is one of the best and the most safest newer treatment for controlling the disease of allergies, and we have very good results with the patient. Under guidance of ma'am, we have treated many patients over the last 6 and 7 years and tremendous results. So we are happy with the results.
Very much glad to know that. So, do you encounter the patients with giddiness and migraines, and what are the treatment and how do you manage it?
Giddiness, first I would like to describe. Giddiness is a sense of environment moving round and round around the patient. So patient feels as the environment is moving or his or her head is spinning round and round. So this is giddiness, or in medical term we call it vertigo. So vertigo has many causes. So it can be, we can describe it as positional vertigo, which is because of certain positions. We can describe as inflammatory vertigo because of diseases like labyrinthitis, vestibular neuronitis, and also so many diseases called Meniere's disease. So, but these are all basically diseases of the inner ear. So inner ear diseases constitute around 80% cases of vertigo. 20% of the cases are because of central, diseases related to brain. So 80% of the causes are because of ENT reason, and specifically because of the inner ear. So management of vertigo will depend on the type or the cause of vertigo. So positional vertigo, generally repositioning maneuver helps. Inflammatory vertigo generally requires labyrinthine sedatives, and Meniere's disease will require oral tablets for quite a long time. So it depends on disease to disease, so it will be very elaborate to say now, but yes, everything is treatable. And we'd like to add one thing, that for diagnosis of vertigo, various methods are required. We may need an MRI, we may need what we call VNG test. So these things are required to properly diagnose and treat the patients. Now, we have all these facilities in our hospital. Now coming to migraine. So migraine is basically a disease where there is some abnormal subcortical activities in the brain waves or brain activity that leads to vasodilation that causes the headache. So migraine is a disease of exclusion. Once we exclude that there is no other causes of headache, then we term it as migraine. So again, migraine, the most effective method of treating migraine is lifestyle modification, because migraine is a disease that generally has a trigger. So this trigger may be anxiety, this trigger may be hunger, this trigger may be exposure to sunlight, this trigger may be change in weather, this trigger may be anything. So whatever the trigger point is, we need to find out what is triggering the thing, and we need to find a method to avoid those triggers. And of course, if someone is having frequent headaches, so generally we say that we give migraine medicines or therapy for long term when a person is suffering at least 8 to 10 episodes of headache in a month, and each headache lasting for more than an hour. So there are various definitions. Some even start treatment in 5 attacks per month. Some start when the duration is more than 3 hours. So whatever, depending on the patient's suffering, we generally start with oral medication, and over time we have to teach them to avoid the trigger factors. Exercise help greatly in migraine. We ask people to do some sort of exercise, maybe going to the gym or doing yoga lessons or going for a walk. So the thing is that this type of things makes a person happy, and we have some happy hormones in our body. If we increase those hormones, we generally get less attack of migraine. Thank you.
Thank you so much, sir. Sir, is it safe for a person to have a hole in the eardrum or a perforation in the eardrum? And how do you manage it? Like, what are the treatments for it?
Okay, eardrum can be divided into two parts. Okay, upper part and the lower part. Upper part perforation, in common term we call it unsafe. So definitely unsafe perforation, we have to get treated. A perforation in the lower part of the eardrum, we call it safe. Safe means that you do not get very serious complication from this, but definitely you will have some problem. Few people are lucky enough to have a perforation and they pass on with their life without any problem, but majority of people are not lucky. They will have hearing loss, they will have repeated ear infection that can lead to permanent hearing loss, and in some more unlucky patient, even with safe perforation, you may have paralysis of the facial nerve that can cause a facial asymmetry. So I would definitely advise that if you are having problem, at least come and see a doctor, at least he can advise you what needs to be done and how to get treated.
Ma'am, also in Northeast, head and neck cancer is very common. So what are the early preventions or what are the treatment modalities for that?
Thank you. This is a very important question for all of us. Head and neck cancer, the incidence is very high in the northeast region. So I have already talked about my initial part that you consume of tobacco, chewing, and the betel nut, which is very popular in the rural part of this part, and also consuming alcohol. These are the main three basic cause, and genetic factor is also there. So that's why these are the some, I cannot say these are the cause, but these are the factors responsible for cancer in the throat or head and neck region. So I advise people that away from these things. When you know that this will lead to cancer, then why you consume for tobacco, why you consume betel nut or alcohol? So away from all these things and lead a very healthy living style, and definitely it will improve your health and also prevent cancer.
Thank you so much, ma'am. This was very important for Northeast. So finally, I would like to ask ma'am that our audience, do you have any advice for our audience?
Yes, thank you. Already we have discussed all the different diseases which are commonly seen in ENT department, and they have nicely advised what are the conditions and what are the symptoms and how we prevent this and how we treat it. So my message is awareness. It is very important. Awareness against cancer, awareness against deafness. This can be preventable. So if you prevent the disease, it is better. See, for example, a small boil in the nose, if you do not treat and neglect, it may spread to brain and may cause complication, may death to the patient. So do not wait when the disease is not curable with the medication. You should immediately visit a ENT doctor or reach to us so that we can treat you and give a life. So this is very important. Do not neglect any disease or pain in the throat or an ulcer in the mouth cavity or swelling in the neck. So these are the early signs of cancer, maybe some hoarseness of voice or difficulty in swallowing. If you feel these things, do not wait, and you come to an ENT doctor immediately and treat it.
Thank you so much, ma'am. I would like to thank Dr. Prisni Devi Datta, Dr. Dipanabha Jyoti Das, and Dr. Swagata Khanna ma'am to be on the set and here with us, and thank you so much for your valuable time. This was really important for the viewers to know, for us to know. Thank you so much.
Thank you very much.
Thank you so much for watching the 4th health series of Swagat Hospital, Guwahati, Assam. For any appointments or queries, kindly contact the following contact number given below.